Back, everybody. When our next guest started losing some of her adult teeth at a young age, dentures came to mind as a way to deal with the problem, but instead, she has something even better. Joining us to explain the procedure is Dr. Wayne Brueggen with Brueggen Dental and his patient, Shireen Reeves. Hi. You have had almost a lifelong battle with your teeth.
Yes.
What was the issue?
Just no calcium, crumbly teeth, bite into something hard, and the teeth would just crumble away.
Oh, it's like that nightmare that a lot of us have, that your teeth just start falling apart, but it happened to you in real life.
Before I was a teenager and continued, I had thousands of dollars of dental work done.
Wow. How did that impact your confidence?
I was embarrassed to smile, kind of shy, not very outgoing.
Yeah, and it's tough for anybody to deal with, but most of us, if you're dealing with teeth issues like that, it's at a little bit older age, so as a child, that had to be really tough for you.
It was. I figured out a lot of ways to fix my teeth to where people couldn't see the issues that I was having.
Yeah, but how horrible to have to, like, a smile should be so natural to all of us, and then have to figure out ways to hide it. And you deal with people like this all the time who come in. Yeah. And so how do you see that their confidence is shaken?
Well, you can imagine, Deborah, you're a beautiful young lady. Imagine if, for whatever reason, all of a sudden you had no teeth.
Yeah.
How would you feel?
Yeah, it'd be tough.
You know, it would be devastating. It's crippling.
Yeah.
And it's an incredible blessing to be able to help people with that.
The good thing about this, too, is that dentistry has come such a long way, and there's some amazing things. So typically, how would you have dealt with, in fact, so what are some of the things that she had to go through in her journey to get to where we're going to talk about today? There are typical ways of dealing with it. Dentures come to mind.
Well, of course, that's what comes to mind to almost everyone when they're talking about losing their teeth. You know, if you think you're going to lose all of your teeth, what did our parents do? What did our grandparents do? They wore dentures. You know, who wants that? No one. And it's not necessary anymore. It was for many years. It was in the beginning of my career. As a matter of fact, the problems that led to for people, or what led me down the journey to where I am. It was obvious that a person who was wearing dentures was crippled, and there had to be better ways. And they continued to progress, and now we have the ability to completely give a person back their life again. They don't have to live like that anymore.
Yeah.
And it can happen quickly in a day.
Okay.
It doesn't need to take weeks or months.
Right, like it used to. Well, that got an amen in the crowd. Right? Okay. Tell us, about the procedure that you used on her, and who's a candidate for that? Well,
anyone is a candidate for it who is either missing all of their teeth or they've been told they're going to lose all of their teeth. It's a simple process of placing 4 implants and building teeth on top of them. Can be done in the same day. Even if a person has teeth that are going to be lost, where that has to be accomplished, that can be done in the same day. So in one day, a person can go from just a devastating situation.
That's incredible.
To nice, beautiful teeth again.
Those are implants. All right. Yes. Smile big, because we saw you before and after picture, but we want to see it again. Smile big, and I want to get close up here because you have a little bit of lipstick on there, but that's okay. You've got teeth. Yeah, she's like, I got teeth. What a problem to have, right?
Yeah.
That's right. And they look so incredibly natural.
Yes, they do.
All right, so when you first turned around and looked at them, and by the way, I was just going through kind of the history of what you've dealt with your teeth. You said as an early age, I mean, there were crowns, there were partial crowns, your gums were deteriorating, gums receding, all these things that you dealt with. In 1984, your baby son kicked out 2 of your teeth accidentally?
That's how weak they were. I was holding him on my lap, and he, you know how little babies kick and stuff, and just happened to kick me right and knocked out 2 of my teeth, and they just crumbled out of my mouth.
Wow, okay.
So, yeah.
So, how did you find out about this, and did you believe that it could really happen this way?
I researched it for about 3 years and could not find anybody local anywhere in this general area of the country. It was in New York or Northeast, and I just kept researching and finally found Dr. Brueggen, and thankfully found him. But it took me about 3 years.
The minute you finally looked in the mirror.
Oh, I was just amazed. It's like I could smile and just be confident. I mean, you know, not smile like this all the time.
Yeah. Did it take you a while to get used to that?
It did. It took a little while to get used to it, but it's been a year and a half now.
Yeah.
So now I'm just I don't even think about it. It's just great.
And what's interesting, too, is I bet people receive you a little differently, too, because when you do this all the time, there's a perception that's sent.
It's like, what are you hiding, or something. So now I'm just like outgoing, and I'm not embarrassed anymore. So it's unbelievable.
And what's it like for you to finally take that mirror and say, okay, are you ready? Here you go.
It's amazingly gratifying. You can only imagine, you know, the average patient at the end of that day looks in the mirror and cries, and it's amazing.
Yeah. Talk about the process a little bit. We're looking at the animation here of how this is a little bit different. You use 4 pins when typically what would be used?
Well, traditionally we would use 8 to 10. You see the little red line on that model. That was a nerve, and that prevents us from being able to put implants in the back oftentimes without having to do bone grafting, which really complicates the procedure, makes it take a long time. This process uses angled implants. We can avoid the nerve, use fewer implants, get the procedure done quickly and efficiently.
Yeah. Is a patient knocked out?
Well, they're sedated. We call it conscious sedation.
I want to be totally knocked out.
You want to be totally knocked out?
No, we want you a little awake.
Yeah.
Okay.
So and I think when you're in a situation like you're in, you don't care what the recovery is, but it turns out the recovery is not bad, is it?
Oh, no, it's immediate.
Yeah. And so you don't have to take anything out.
Nothing.
You can eat anything you want. So basically, the teeth that you got are really better than any teeth you could have had.
Better than any teeth I had my whole life.
Yeah.
So,
right.
you know.
Well, you have a beautiful smile.
Thank you.
Thank you for helping me
Thank you,
get that.
Deborah. Thank you very much.
We have 3 $250 gift certificates for the audience, but the caveat is you got to have some teeth gone. Okay. So, wait, give me my microphone. Where's the microphone? Give me the microphone. Wait, where is it? Wait. Okay. Do that again for me, ma'am. There you go. Oh, wait. Look at the camera. You got to show. See, she took that. Put your teeth back in, sweetheart. So this is something that you certainly understand, huh?
Yes, I would love to have teeth like she has.
Okay, well, we can get you there. All right. Wow. The funny part is several of you raised your hand and said, I can take mine out too, Deborah. Right? But the good news is, tough battle for a lot of people. Good news is the technology is there now to take care of that. For more information on the services offered by Brueggen Dental, call 800-615-5818, 800-615-5818, or you can go to nodentures.com. Nodentures.com. Thank you all very, very much. You know, that's the first time someone's taken their teeth out on air here at Great Day. For many people, coming up next, it's their looks that impact their confidence. When we come back, erasing the signs of bad aging, sunspots, wrinkles, and other defects to the skin.